Well, just a huge thank you for having me and for really organizing this fantastic event to talk about an issue that affects so many animals and so many communities. And so I'm very privileged and honored to speak to you today about many of the programs that we run as an organization as Paws throughout Southeast Asia. And I certainly recognize that there are some inherent differences between Southeast Asia and Taiwan. Like those will be pretty obvious. But I do think there's some very important similarities and some general practices and principles that we can use to make sure that we are operating as effective as possible and doing the best that we can for the animals, no matter where we are in the world. I wanted to start by just introducing the organization a bit, just to give you some context in terms of where the projects are and the types of activities that we incorporate into each project, because obviously every place is geographically different and the underlying issues that drive animal welfare are different. So Paws is a very large international animal welfare charity. We have offices in 15 countries around the world. So I work out of our Bangkok office, but we have offices in Myanmar and Indonesia and Vietnam. But our headquarters is actually in Vienna, Austria. So it's a very big animal welfare charity in German-speaking countries. So the largest actually in Germany, Austria, Switzerland. I focus on companion animals, so on cats and dogs, particularly in Southeast Asia. But the organization as a whole, we do both farm animals and wild animals. We have wild animal sanctuaries throughout Europe and throughout Asia. You'll actually see in this photo here, this is actually a cow. It's not a dog, but we do disaster relief missions. This is from the earthquake in Indonesia last year. And so we run sustainable campaigns, programs, initiatives to help improve animal welfare, be it farm animals, wild animals, companion animals. So in terms of just our companion animal programs, so our programs that focus on cats and dogs, we have a large Eastern Europe program. So we have vet teams in Ukraine, Romania, Bulgaria. And these teams are focused on doing high volume surgery. So they really don't do much else but that. So these are surgical teams that operate almost yearly, except for the months that it's just too cold to put the dogs back. But we work in these areas because probably, I'm assuming as you heard yesterday, there are significant stray animal welfare issues in these countries. And so we really try to focus on doing high volume sterilization for cats and dogs that are living on the streets primarily. So outside of Eastern Europe, we also have a Southeast Asia program. And so this program works with local charities throughout the region because the levels of veterinary medicine, the levels of sheltering, the levels of animal care can be quite low in many of these places. And so we work with local charity partners to help support them to build their capacity to run programs that improve the welfare of dogs and cats in Thailand, Cambodia, Vietnam, Indonesia. And you've probably already heard about this document, you've seen this document. This is the ICAM, Are We Making a Difference, or dog population management, one of the dog population management standard and kind of guiding documents. And so all of our programs, it doesn't really matter where they are. It could be in Vietnam, it could be in southern Thailand. There are certain guiding principles that we have to make sure that all of our programs conform to. So while every program is different, some might have education, some might focus on spay-neuter, some might focus on veterinary training. We try to make sure that we, include all of these principles to make sure that our programs are actually the most effective that they can be. So what I wanted to do is just provide you with a very brief snapshot of some of our local programs that we run in the region. And again, this is going to be very brief. Certainly we could talk a lot about each of these programs, but just to give you an idea of some of the issues that are facing dogs and cats in these different countries. And then for the second half of the presentation, I'm going to focus on describing a very large-scale intervention for stray dogs in Bangkok specifically. So some of the issues in Cambodia are very poor veterinary training. So veterinarians typically in Cambodia, they graduate, they have never touched a cat or a dog before. So asking them to do surgery, there's a lot of training needed. And the reason for that is because the veterinary curriculum is focused on animals that are of economic importance, so livestock. There is also a very thriving dog meat trade, so a lot of eating and stealing of dogs. And so that also undermines our ability to run dog population management programs, because that is the dog population management technique, essentially. And another issue, and we see this in Thailand as well, so this is a big issue throughout most of Southeast Asia, in Buddhist communities particularly, is we see the dumping of unwanted animals, particularly at Buddhist pagodas or temples. There's a common misconception that, okay, monks, they go out and they, receive food from community members every day. If I dump my animal at a temple, the monks will take care of it. But typically, the monks might feed the dogs, and there are some that seem to be a bit more compassionate towards the dogs than others, but generally speaking, the dogs receive no medical care, no sterilization. There's a lot of disease and welfare issues. So our program in Phnom Penh focuses specifically on these pagodas to provide education, resources, and free spay-neuter services. So this is a good example of a situation where spay-neuter alone does not solve this situation. That there's a complete lack of legislation, enforcement, protection for animals. And so we really have to work on community engagement, education, in order to help the animals, in addition to spay-neuter. But we do, field spay-neuter clinics. So we go to temples, and we're always trying to target at least 70 to 80% of the dog and cat population, if possible. But we have to be able to get the monks on board. Like, the monks have to be understanding and allow us to do spay-neuter surgery. So that can take months sometimes of constant engagement and education. But once we have their commitment to helping improve animal welfare and to working in their community, then we bring a mobile team to go there, set up, and to do surgery for the dogs and cats. You can see in these photos. In Vietnam, different place, different issues. Similar, very limited spay-neuter capacity because veterinarians aren't trained in spay-neuter. There is also, again, a lot of dog and cat consumption, eating, and theft of both strays and of pets. So you don't see a lot of stray dogs and cats in Vietnam. And so our program works to provide free spay-neuter services. We train local vets, and we do educational workshops, both at the veterinary school and in the community. In Bali, we have a program, very beautiful, obviously, very beautiful area, but a lot of animal suffering. A lot of rabies cases, which leads to a lot of government culling, a lot of government poisoning of dogs. And so we have a program called Program Dharma, and that really tries to go into communities, working in communities, to vaccinate the dogs, to sterilize the dogs, and to help ensure that they are safe from rabies and safe from getting poisoned by the government. So this is one of our mobile clinics that we do, and we do these twice a month in project communities, and we go in and we offer free spay-neuter services to pet owners, members of the community. And we also partner with the government. So there's a lot of municipal government support for this program, and they will actually send their government vets to these clinics to provide free rabies vaccinations. And so this program has done a lot of education, done many sterilizations, vaccinations. And so just some of the successes is that it has reached 80% vaccination coverage for dogs. And we've actually seen a drastic improvement in dog health. So we look at the numbers of dogs that are thin or emaciated, and we've reduced that to less than 4%. But probably the most important part is that the dogs are more accepted in local communities because they're healthier. They're no longer a risk to give people rabies. And the government has stopped any culling programs in these program areas. But we also need to think bigger. Like, we can have these programs in these cities or in smaller municipalities, but it's also important to think about how can we scale up? Like, how can we make sure that we have the biggest impact? And so this is actually in Indonesia. What we're also doing with an animal welfare charity in Jakarta is we're building a big online animal welfare educational platform in Bahasa language. And so this will have resources for pet owners, it will have resources for the public, resources for teachers, and we'll also hopefully integrate these resources that we're making with the Ministry of Education to roll it out on a national level. So that was a brief, very fast overview of some complex programs that we have in the region. But what I wanted to kind of slow down now and talk a bit about Bangkok and the animal situation and the program that we launched there a few years ago to try to manage the massive number of stray dogs and the conflict that was causing. So just a bit about Bangkok. Obviously, it's the capital city. It has a human population of over 8 million people. It has 2 international airports. It's divided into 50 districts, which makes it convenient to also target certain areas for spay-neuter. It's Buddhist, so that plays a role. We'll talk about in a minute with stray dog management. Traffic is really terrible. If you've ever been to Bangkok, you know, just awful. But that's also, what the implication also is if you're running a dog population management program and you have dogs in the back of a truck, you know, and you're stuck in traffic for hours, it's really difficult, yeah, and stressful for the dogs as well. And it has a huge stray dog population. If you've been to Bangkok, you've probably seen outside every 7-Eleven, there's many dogs enjoying the air conditioning from the door when it opens. And Thailand has an interesting relationship with dogs, because His Majesty, who passed away recently, was a big dog lover. Yeah, he really spoke out for dogs in the country, encouraged Thai people to take care of dogs, to adopt Thai dogs. And so there was a real opportunity in the past to really use this to promote humane welfare towards dogs and responsible ownership. Similarly, when we were talking about Cambodia a few slides back, we see similar situation in Thailand where, you know, with Buddhist culture, there is a lot of feeding of dogs. I always say if you're a stray dog in Asia, the best place for you to probably be is in Thailand, because you'll probably get fed. You might not get care more than that, but you'll usually have food available. I mean, you can see this is a good example where, you know, you have a lot of feeding, rice, and this dog looks pretty terrible, skin condition and whatnot. And this is pretty typical. And so the issue with this is that by increasing the constant food supply, you're also increasing the dog population, right? Because you're creating, the capacity for more and more dogs. And so when we have a lot of feeding, but we don't have a lot of spay-neuter, you know, then it's quick that the population can grow very rapidly. So again, I think these photos also kind of summarize the situation as well. You have a lot of feeding, it's well-intentioned, some people like the dogs, not all of them. They like the dogs, and then what do you have here? You have births of puppies, and this is particularly a problem when we think about a city like Bangkok. It is very metropolitan, and has a lot of traffic, a lot of tourists, and so that's where there's, again, this conflict. We also can't really talk about dogs in Thailand without addressing the trade in dogs for meat in Thailand. And so this is, you know, really prior to 2013, we saw a rampant trading and theft and trafficking of dogs from particularly northern Thailand into Vietnam for consumption. And at the height of the trade, we estimate about 500,000 dogs were being trafficked into Vietnam. So this was, in effect, the dog population management practice, right? Like this was managing the population in northern Thailand for a long time. And then when this largely stopped, because Thai people do not, as a general rule, 98%, do not eat dog meat. They don't believe in dog meat. They don't think it's right. And so the government started cracking down on this. So there is a concern that now that this has stopped in northern Thailand, what will happen to the dog population in those areas? And so these are probably obvious, but when we think about, okay, well, you know, why do we want to do something with the stray dogs? Like, why do anything at all? Well, there's certainly issues that affect people, right? There's road traffic accidents, dogs can disseminate garbage, tourists often don't like to see dogs in need. There's certainly some diseases, particularly rabies, that we're concerned about. And also there's a plethora of welfare conditions for the dogs as well. We also have to really consider dog population management in relationship with rabies as well in many of these countries, because that is the driving issue for most government agencies particularly. Usually governments don't tend to care too much about animal welfare, but they do care about rabies, they do care about people dying. And so we often use this, right, to our advantage in animal welfare as well to try to advance animal issues on the political agenda. But we can see here, it's not really important, the years got cut off there, but you can see that generally there's a positive trend because rabies cases are going down. So we can see, we can track both human cases and we can track both animal cases, and human cases now are less than 10 a year. There is a big push for Southeast Asian nations to go rabies free. There was a deadline, a target set by 2020. That's in like 20 days. So I don't think that target is, in most of the countries going to be met. But we can see also here on the map on the right, we can see where animals are testing positive. So it is quite geographically apparent that there are certain areas, particularly along the border here with Malaysia, along the Lao-Cambodian border. Certainly some in Bangkok. I mean, this is concerning. It's all concerning, but particularly when we have a major city. I suspect that this area here, probably highly rabies endemic, but we just have lack of reporting. And last year, there was a lot of media about what was considered to be a rabies outbreak, a rabies scare, or whatever you wanted to call it. When you look at the figures, it's not really clear that it was actually an outbreak. There were 4 human deaths that were recorded by March. So yep, that is concerning. However, in the last calendar year of 2017, there were 7 rabies deaths. So it wasn't necessarily a huge outbreak, but it created this mass panic. And so there was dogs testing positive, there were human deaths, and so the reaction, the knee-jerk reaction, which is typical of many governments and many political bodies, is they wanted to try to contain it, and do something about it. And so what they ended up doing was rounding up about 5,000 dogs and putting them in these government-run shelters where the vast majority of them died over a course of about a month from disease, malnutrition, not receiving medical care, and not a single one of those dogs tested rabies positive or had rabies. And so it was a knee-jerk reaction to just, okay, we need to do something. Let's, we don't want to go and kill all the dogs because that doesn't look good. And it's Buddhist, so they don't, they're not quick to euthanize anything. And so they rounded up dogs, which ended up dying. So now let's take a step back and look at specifically Bangkok, kind of go back to that city. And so if we look at, well, how has Bangkok in the past managed dogs? Largely, they ignore them. Largely, they let them be until they create problems or until there's cases of rabies. There are shelters in Thailand and near Bangkok, in Bangkok, and these are places where usually problem dogs are taken, and these dogs are provided very little. They are sterilized, but there is no adoption program. There is no socialization program. They go there until they die, is essentially the sheltering situation in Thailand from a government perspective. There is about 2,000 dogs on average in a shelter called Prawet, which is in Bangkok. There is a larger shelter in Uthai Thani that houses up to 8,000 dogs in pretty inhumane conditions. There are some reports of poisoning as well for dogs that are aggressive. And again, a lot of dumping of dogs as well. So we know we can't shelter our way out of the issue in Thailand, just given that there is very limited resources to give to shelters. Animal care is very poor, and there are just too many dogs. I think an important point is nobody has done an accurate survey of dogs in Thailand. Again, it's a large country, and some areas are more difficult than others to access. But there are in excess, I'm sure, of 10 million dogs. And so we know that shelters just don't solve the problem in terms of dog population in Thailand. When we look at who is responsible, I think this is often a question that comes up. Okay, we know we have this dog problem. So where does the burden of responsibility lie? And it tends to always fall on the NGO. It tends to fall on the dog lovers, pet lovers, spay-neuter groups, when in reality, there's usually some responsibility or some burden to manage stray animals, to protect public health, and that's borne by government agencies. And so when we look at the government agencies that dog population management, rabies control would fall under, there are two in Bangkok specifically. There is the Thai Department of Livestock and the Bangkok Metropolitan Administration. So then when you look at what those organizations are doing, those government agencies, they are doing something. And so there is credit to be given, because in many places we see municipal authorities not doing much of anything. But we do need to give credit where credit is due to the Bangkok Metropolitan Authority and the DLD, the Department of Livestock, because they do hold these clinics. So they do have clinics that go out usually on a Sunday. They will offer spay-neuter services for owned animals, for pets. And the Thai Department of Livestock has a small clinic in Din Daeng, which is near Dam Muang Airport. And they do some sterilization primarily of owned animals. But these programs are not enough. Like offering spay-neuter services only to owned animals, we know that the vast majority of dogs in Bangkok are not owned by one person. They're free roaming, they're community owned. They're certainly not going to be put in a car, in a vehicle, and taken to one of these clinics. Okay, that's just the reality. We also know that these programs do about 20,000 surgeries a year. And that sounds really impressive. It is impressive for a government agency. But I'm going to talk about the fact that we know that there's over 500,000 dogs in Bangkok metropolitan area. And so that scale is not going to address the issue in and of itself. So I also want to take a step back and just say also that this program, and this is the program that I'm talking about, was when I was employed with a group called Soy Dogs. I just want to also give them credit because this is certainly their program. But what we had decided is that really what we needed to address animal welfare on the scale that was needed in Bangkok was a large coordinated effort. And that would need to involve a multitude of stakeholders. It would need to involve the government. But we had to do something that was a bit more coordinated than what the government was doing at the moment. So then we started thinking, okay, well then, we know there's a problem and we know it's happening now, but what can we do? What can we do and what does it cost is usually the fundamental issue of these programs as well. And so we started thinking about different funding sources. And I mean, that's one thing I will say, that usually the funding is out there. The funding is out there, but you have to find it. It's certainly not going to just come to you. But it really takes recognizing what the situation is and putting together a proposal. And so I'll talk about this in a bit later, but we reached out to Dogs Trust in the UK to help fund some of this program. And I'll talk a little bit about how that works in a few slides. So this is not unique for Bangkok. This can be applied to any program, but whenever we're going into a community or a location and we're trying to figure out, what can we do to improve dog population management or to just improve the animal welfare situation, there are certain things that we need to know. There's certain data that needs to be collected, right? And one of the biggest ones is how many dogs. It's like going grocery shopping for your family. You need to know how many people you're shopping for, or else it doesn't make sense, to know how much to purchase. And so we need to have a general understanding of how many dogs, both owned and the ones that are free roaming, that are on the streets, right? We need to know where the dogs are coming from. And I think you just saw that in the presentation this morning. What are the welfare issues that are facing, that the dogs are facing? Again, who has ultimate responsibility for controlling these problems? What is being done, and who do we need to engage with? We also have to look at, again, the factors driving the dog population. So influential factors, human attitudes, how do people feel about the dogs? What are the actual issues? Sometimes we think that people just don't like the dogs. We often think, oh, well, people just hate the dogs. They don't. But oftentimes, there's issues where people are scared for their children. Maybe the children are getting, bitten or barked at on the way to school. Or maybe they're scared of rabies. They might have known someone in their community that died of rabies. So we need to understand also what the human attitudes are And also, again, this access to resources, because again, this is one of the issues that really drives dog populations in Thailand as well, is this rampant access to food resources. And when we think about dog population management, oftentimes we think about the surgery, the sterilization. And you've probably already heard this in other lectures, so I don't have to go into detail on this, but there is a whole toolkit of things that we can do. Like I mentioned in other places in Southeast Asia, I don't think spay-neuter is even, it's lesser of importance, particularly when there's rampant theft and dog meat trade. And so, spay-neuter doesn't really solve the issues with animal welfare. And so we can we can think about how do we educate the public? How do we reduce abandonment? Can we enact any type of legislation? Can we, such as mandatory registration or identification of pets? We can sterilize dogs. We can vaccinate them. We can euthanize them if they're sick, or if there's in some sheltering systems we see euthanasia as a dog population management tool. We can shelter them. We know that that's fraught with a lot of issues in and of itself. And then we can also manage resources like garbage control as well. And it's very difficult for one organization to do all of these things, right? A lot of these are more political functions, particularly from an NGO perspective. And that's where there is such opportunity for NGO and government collaboration on these types of programs. Because what the NGO often brings, they often bring veterinary expertise. They might bring, teams that could do vaccination, whereas the government might be more apt or more, positioned to do some of these other things. And so for this program that we're talking about in Bangkok, we recognize as a charity that our strength was in these two. Our strength was in sterilization and vaccination. We had very little, political lobbying ability. We certainly weren't going to be building large shelters for dogs in Bangkok. So we recognize that our contribution to dog population management in Thailand really would be best spent through sterilization vaccination. So we knew we wanted to focus on the surgical aspect. But then, what does that look like? In practice, you have hundreds of thousands of dogs. They're spread out over a large geographical area. So how are you going to deliver those services? So are you going to set up permanent clinics? Are you going to have clinic buildings? Are you going to have teams of vets going into the community, doing mobile clinics? And where are those mobile clinics going to operate? Where do you want to start the program? How often are you going to have clinics? Are these going to be monthly clinics, daily clinics? What does that look like? Again, who's going to fund this, this amazing program that you have in your head? And how are you going to collaborate? Who else needs to be part of this program? And also, how do we know if our program is successful? Sure, we can say, okay, we sterilize 100 dogs, 1,000 dogs. What does that actually mean? Are we measuring welfare indicators? Do we know that the population has humanely decreased over time? And so I'm not going to go into detail on this, but there has to always be a way of measuring our effectiveness to know that, our investment is well spent. Getting a bit nervous about time, so I'm going to go maybe just a bit quicker. So one thing you have to know is how many dogs, right? How many animals, or cats. If you're working on cats, this is important as well. Cats more challenging. But we had to know what the dog population looks like in Bangkok. And that's not an easy task to do. And this is a difficult place to survey as well, and similar probably to Taipei. It's very urban. And so we wanted to know about how many dogs there are, and also some information on the dog population itself. So there are ways of doing this systematically. The way that we chose to do it is I'm not going to go into too much detail on this, but we chose 2 kilometers of road, and we took a representative sampling of roads throughout many different kets or districts throughout Bangkok. And we went out at the times that we know that dogs are more likely to be outside, which is usually in the early morning because it gets very hot during the day. And we also use a method called catch mark recapture. And that's where you actually try to spray paint some of the dogs that you see on certain tracks, and you go back the next day and you see how many dogs you see that are spray painted. And that gives you an idea about what percentage of dogs you see at one time. And I'll spare you all the mathematical calculations, but what we came up with was somewhere around 600,000 free-roaming dogs in Bangkok. And just very briefly about how we kind of thought about how to design the program. Okay, so now we have a general idea of how many dogs. We know the stakeholders that are involved. And so if we want to do mobile clinics, and there was a lot of calculation involved as well in terms of dog population, so I'm not going to get into the details of that. But we set a goal of sterilizing and vaccinating 80,000 dogs a year, generally speaking, to complement the work that the government agencies were doing as well. This is a long-term program, right? This is going to take many years, and so we foresaw this as a 7 to 10-year program, but that's with ongoing maintenance as well, because these type of interventions are not just one-offs, they are long-term initiatives. We wanted to work with the government in areas with the highest incidence of rabies, which is how we picked our first pilot areas. And rather than actually having traditional veterinary clinics, we would use mobile teams. And so the idea was that we would recruit a team, and the team is normally 2 veterinarians, 3 nurses, and a mobile manager, and a team of dog catchers. And that we would launch a new mobile team every 6 months, so that when the program's operating at full capacity, there would be up to 10 teams essentially working in different places throughout Bangkok. The goals for each veterinarian, the general expectation is about 25 dogs per day. So if you have 2 veterinarians and all they're doing is standing at a surgery table, like they're only cutting, that we would expect about 50 dogs per day. That's about 1,000 a month per team. And there's a lot of difficult decisions to be made from a veterinary side about how you do your anesthesia, what surgical and medical considerations. A common discussion point is usually using gas or using injectable anesthetic. And I don't think there's, one is right and one is wrong. There's ways that we can adapt to different situations. We were fortunate to have the funding to have portable gas anesthesia machines. And so we really embrace that, but many clinics that we run do not have gas anesthesia, and they work just fine as well. So the big question is, I'm going to talk about this in the next lecture, but when to release the dogs. So you have a stray dog, it's come in for surgery, and there's a lot of controversy, a lot of discussion about what to do with the dog. So we'll talk about that in the next talk. And then things like, how do you sterilize your instruments? If you're doing 40, 50 surgeries a day, do you have autoclaves? Are you using cold sterile? What are you doing with your instruments? And instruments are expensive too, so it's hard to have that number of instruments at hand. And again, what do the clinics look like? And so these are not from Bangkok, I'll just say. This is from Sri Lanka. I'm not sure where these other 2 are from actually, but there are different ways to deliver care, right? Some clinics find using a mobile vehicle of use. This is more of a traditional veterinary setup. This might be, a municipal building. And so the way that we decided to run our clinics is that we would partner with the local municipality, and usually they would give us, a government building or some area that we could use to set up our clinic. And we also asked for 2 other things. We asked for them to advertise the clinic, to get the word out to people in the community, in the target location that we were working in, and to also provide lunch. But that was usually, plus or minus, they would provide that. And these clinics are machines. So these teams work 5 to 6 days a week, and they do just this, so they are very efficient at doing surgery. Then we also had to put together a budget, and I'm not going to go into details, but these clinics cost money at the end of the day, right? And so the funding arrangement that we had with Dogs Trust was that we as an NGO, we would fund 1 mobile team, and once we showed success, then they would fund the next mobile team. And then we would fund a team, and they would fund a team. And so there was a cost sharing involved to fund this program. In order to be effective, it's just really important to note that we can't dilute our efforts. We have to target an area and try to sterilize as many animals in that area. If we just do 2 dogs here, 5 dogs here, 20 dogs here, it doesn't work. You don't achieve population level coverage and the sterilization coverage that's needed to actually get population reduction. And so with our clinics, we always focus on an area, a district or a sub-district, in order to hopefully achieve that 80% sterilization coverage. And so we focused on this area called Ketla Krapang, because we knew it had a high incidence of rabies, and we knew it was, a good pilot area that we could just focus our efforts on, and we worked there for 6 months to start. So the first team had to be recruited, right? And so this program was actually launched in August of 2015, and we had to train all of the staff. And so we found that it typically took vets about 3 months of intensive training, doing surgery every day, to where we felt comfortable and confident sending them out that they could do high quality, high volume surgery. So they would train with us for several months, and we also sent the dog catchers actually to Sri Lanka to start. This was funded by Dogs Trust, to actually learn about catching dogs with nets and different catching techniques. And catching dogs is truly an art in and of itself, and one that I'm not certainly an expert on, but we, try to use the most humane methods whenever possible. Again, Bangkok, larger cities present, certain, considerations, but certainly, we can still be successful in catching dogs in these environments. It was more the transport that was probably the largest issue given the traffic and just logistical challenges. So this is what the housing normally looks like. So we set up enough cages to house all of the animals, ideally individual. So they are caught in the community. They're brought into, put into these cages. Then they have surgery. They're brought into these cages, and then they're typically released later in the day. We have to have a way of identifying the dogs, right? Because we need to make sure we're not recapturing them, putting them under surgery again. And so a technique that we were using was to tattoo in the ear. We could tattoo a 3-letter code. And we were also using just some cheap kind of nylon with rivets that we would attach to the dogs. I mean, this would fall off within a month or two, but at least we knew not to recapture that dog. The problem with this technique, though, is that it's almost impossible to do a survey later on from a distance without actually looking in the ear or seeing that the dog is, a male dog is obviously sterilized. So there are different challenges and there are reasons why this was pursued, but there are also better ways of doing this in other situations. So I just wanted to mention that. A lot of different anesthetic protocols, and so there's really no need to go into detail on that here. Dogs were given an induction agent. Most of them were given Zolatil. Zolatil is, can be quite expensive. We ended up transitioning to Propofol IV, and that was at the request of our donor agency. So we switched to Propofol IV. Dogs have an IV catheter in. They're getting fluids throughout the procedure. They are maintained on gas anesthesia, so we have them on isoflurane, additional Propofol if needed. All dogs are intubated. They receive pain medicine, and also they get oral take-homes if they have an owner or someone in the community. And so I would argue that the level of care that these dogs get in this clinic and the fact that this team is so trained that the time that these animals are knocked down on the table in recovery is so quick, and the complications are so small, so less, that it definitely rivals the care and the morbidity and mortality rates at a traditional veterinary clinic, hands down. So this looks pretty controlled. Like, it looks like a relatively controlled environment. You have a sterile field, you have gas anesthesia, you have appropriate light. I want to show you what this looks like from the outside. So we can create controlled surgical environments that still provide great animal outcomes that are sterile, even in the most difficult or challenging or limited resourced environments. And it was really windy, hence all the tarps. Okay, last slide. Yep. So just so kind of where the program is at, I mean, just very briefly, that the program has indeed launched now 6 mobile teams that are working throughout Bangkok. Over 100,000 dogs have gone through the program, and there's currently recruiting the 6th mobile team now. And so I think just a great example of starting small, but scaling up, and to really achieve, more than maybe we would have ever thought possible. Okay.